what drew you into orthopedics? What excited you about it?
Right. So I come from a family of surgeons. I'm like the fifth consecutive surgeon in my family.
I mean, generational.
Yes.
Five generations.
Yes, yes,
Really?
yes, yes. My dad's a neurosurgeon. My grandfather's a general surgeon. His,
And before that,
yeah.
what did your great grandfather do?
He was a general surgeon too.
So today we have my fellow Dr. Rohit Sane talking with me. I'm Kenneth Cutbush, and we're talking about all things shoulder surgery. Rohit has been my fellow for a year now. He's come from Mumbai in India. He's an orthopedic surgeon there, and he's come over to do a year of shoulder surgery with me to learn all things shoulder. So welcome, Rohit.
Thank you so much for having me over on your podcast, Ken. It's a pleasure.
So, Rohit, you did medical school and surgical training back in India. Tell me a little bit about that experience of doing medicine in India. You know, that must be one of the most competitive environments for getting into medical school in the world. And, millions apply, but only a fraction get into it, and a fraction make it as doctors, and even less get into specialty training. Tell me some of the human side of that experience for you.
So in India, the system is you finish your school and then you get into a junior college for 2 years. Once you're done with junior college, you get into a med school. That's essentially for 5.5 years. So when you're in your junior college, you start training and preparing for an entrance exam to get into med school. I'm pretty sure millions of people apply, around 1.5 or so every year.
I understand that's all changed just recently in the last few years too. It's now a national thing across India, which is standardized for everyone. Whereas I think when you did it, you had a local one or a state one.
Yeah, so when I did my med school, I had the state thing. When I did my residency, the MS, I had the national thing. So that's when I gave my national one. The first one when I gave was the state thing. So yeah, so around 1.5 million people or so apply every year just to get into med school. And out of which I'm pretty sure half of them get into med school, or maybe 1/3 of them get into med school. The others are then they go into dentistry or physiotherapy, etc., etc.
Yeah, it's hard for us to comprehend, isn't it? 1.5 million
roughly
young men and women applying to be a doctor and to get into med school in India.
Right. And the moment you're done with that, that's 5.5 years of med school. You start training to become whatever you want to become. So you give a PG entrance exam. That's the postgraduate entrance exam. That's a national exam again now.
Now, I understand that's every January, once a year?
Yeah, roughly, I think so, yeah.
3.5 hours, 200 multi-choice questions.
Correct, something like that, yeah. It keeps changing, but roughly around 200, 300 MCQs. That's it.
Yeah, and I think last year, 240,000 doctors in India sat that exam in that year, in that one sitting.
Yes.
It's hard to comprehend, isn't it?
Yes.
And your whole career then really depends on how you go in that exam.
Exactly. Ken, so the difference is so minute. Like, you mess up one MCQ and there are like 10,000 people with a difference of just 1 mark. So that's like something else to fathom. Like, that's huge. Can't think about that, but yeah, it is what it is.
And then getting into competitive specialty training positions depends on your mark in that exam.
Right. So
out of 200 questions,
yes,
let's say, so it's no negative marking. That's pretty cutthroat competition.
Yes, it is. And if you look into fields like radiology or dermatology, orthopedics, etc., basically all the fights for that. So, you're kind of blessed and lucky if you get one. Many actually aspire to get in, but not many actually are able to get in. So that's the sad part. Then there's another thing. If you do general surgery, there's a neat super specialty entrance exam. That again goes for another 100 MCQs, 200 MCQs, and it's nationwide again. They also have fellowship exams post your orthopedic residency and so. That again is a national-wide thing again. So it's just competition every time, everywhere.
So you sat that entrance exam to get into surgical training, the one we talked about, the NEAT PGY exam, which is nationwide in India with 200,000 young doctors sitting it. Tell me about some of the sacrifices you went through to pass that exam, because obviously you've passed and you did well in that exam to be here in Australia doing this fellowship.
Well, it's a commitment. Uh, you just wake up and you start studying from morning till night, and then you sleep off. And you can't just randomly study. You will have to prioritize each and every subject. So every subject has a particular amount of marks or weightage, and according to that, you have to uh, come up with a strategy, come up with a plan as to how you're going to tackle it, and you have X amount of months to prep for the whole thing. You give the more revisions you do, the better you become. Like practice, practice, and practice. And then you sit for the exam and hope for the best.
With your whole
Yeah.
life
Yeah.
depending on that three and a
Correct.
half hours and 200 questions. It's crazy, isn't it?
It is.
So you passed that exam. Where'd you go to from there? Where was your first surgical training?
Right. So
This is Mumbai in India.
Right, correct.
Massive, bustling town of 10 million people. Is it 10
25.
25, right. 25 million.
Yeah. So I did my med school in KG Somaya. That was my MBBS. That was for 5.5 years. Then I went to do on MS in orthopedics at DY Patil. That's in Navi Mumbai. That's for 3 years. And once you're done with MS, you have to sit for an exam. Once you pass that
So
exam,
MS, just for the people listening, is the surgical qualification.
right, correct.
Basic surgical
Correct.
qualification.
Yes.
Master of surgery, is
Perfect.
it?
Yeah. So that's for 3 years in India. I gave that. At the end of 3 years, I had to sit for an exam, theory and practical. Once you clear that, then I did a year of post-exam residency. That's senior resident. As a senior resident in that same college for 1 year. After then, I went down south to pursue a fellowship in arthroscopy and sports medicine in Coimbatore.
So where's that?
That's in Tamil Nadu. So I am from Mumbai, from Maharashtra.
So most people have a picture of India, the triangle shape. And
Yeah, correct.
Mumbai is on the west coast, about
Correct.
a third of the way up. So where was this?
This is right down the south, right down in the south.
Okay.
In the southernmost state of Tamil Nadu, near border of Kerala. So it's on the border of Tamil Nadu and Kerala, but right down in the south. It's around 1,000 to 2,000 kilometers away from Mumbai. Yeah. So I was there for 1 year doing a fellowship in arthroscopy and sports medicine. It was a predominantly knee dominated fellowship, 70% knees and 30% shoulders. And then I came here to do an AOA fellowship with you and Ashish, and I've been enjoying every part of it, loving it.
So, we've got an idea of that pathway. Tell me, what drew you to orthopedics? Was there a moment of with a mentor, with a patient? What drew you into orthopedics? What excited you about it?
Right. So I come from a family of surgeons. I'm like the 5th consecutive surgeon in my family.
I mean, generational.
Yes.
5 generations.
Yes.
Really?
Yes. My dad's a neurosurgeon. My grandfather's a general surgeon.
And before that?
Yeah, all general
Go on.
surgeons. Yeah. I mean, I
you
know
remember
only
what they
through
do?
my great
Oh, okay.
grandfather. I don't know before that.
What did your great grandfather do?
He was a general surgeon too.
In Mumbai.
No. A small town in Chiplun. That's one of the small, I won't say cities. I would say small towns, villages in Maharashtra.
And where's that?
In Maharashtra, in the state of Maharashtra. It's on the west side of India, but say like 500 kilometers down
South of
Mumbai. Correct.
Okay.
My grandfather came to Mumbai, and we've been settled in Mumbai ever since. So yeah, so I always had a knack for getting into a surgical specialty. I did my med school. Then I was kind of naive because you're too young, so you tend to listen to people. And I did 3 years of pharmacology. I did MD pharmacology. And I interned in a Fortune 500 company, GSK Pharmaceuticals. I was there for 2 months. That's when I understood that my calling is a surgical field again.
So this is as a doctor?
Yes.
A pharmacologist?
Yes.
Right, this is a pathway I'm not familiar with. And so you go into a large company as a pharmacologist?
Yes, correct.
As a medical doctor?
Yeah.
And what do you do there?
So a medical doctor is basically a bridge between the marketing side and the development side. So you're into research and developing drugs, and then kind of letting know how to market that side to the doctors. So I was interning there, and I was like, I need to get back to what my calling is. That's the surgical side. And I sat for need, gave it again. Gave it that time
Yeah.
and got into orthopedics.
So
And
why orthopedics? Are you the first orthopedic surgeon in
yeah,
your 5 generations?
I've always had a liking for fixing bones,
Yeah.
and it gives you instant pleasure. I've seen you have a broken tibia, you put a nail in it, the patient starts walking the next day,
Yeah. Yeah.
right? So it is gratifying, and I don't think any other surgical field gives you instant gratification.
Well, there's certainly instant feedback, isn't there?
Yeah, exactly.
It
Yes,
either works or
yes,
it doesn't.
yes. Correct, correct. And then I got into orthopedics. And as I started knowing the subject better, I got more and more interested in the field of shoulder surgery. And to my luck, the shoulder surgery is still developing in India. So that's like a boon for me. And yeah, then one thing led to another, and here I am.
So, what's your dream with your career? What is the final dream?
I
What does
want
it
to,
look like?
so I want to be a established shoulder surgeon uh, who is recognized uh, regionally outside as well. And I want to give the best possible care to my patients. That's what I want to do in terms of shoulder surgery and develop the shoulder course and education a little better so that, younger surgeons can learn from that.
Yeah, I get it.
Mm-hmm.
Now, coming from Mumbai to Brisbane, that's a massive cultural leap to
Right.
come here for an AOA, Australian Orthopaedic Association accredited fellowship with me. What motivated you to do that? That's leaving behind your family and friends and everything to come to a new country. What was that like?
It's just your determination to get better in one particular subject that drives anyone to do whatever they want to do. So your name and Ashish's name is all over the globe. And no matter you open up anything pertaining to shoulders, your name, Ashish's name, flashes everywhere. So I knew that very moment that that's where I want to be. And then I tried and did everything possible to make sure that I get the fellowship. And yeah.
Yep, well done. Uh, and then the next question, the obvious one, is coming to Australia. That look, I've been to Mumbai several times. I've operated there. I've done live surgery in Mumbai.
Right.
It was a massive cultural shift for me, getting used to that. What was it like coming the other way around, the cultural shift coming to Australia?
So I came to Brisbane, and the first thing I noticed was everything starts early and shuts early. That's like completely the opposite of what I've
You're
been
not used to
experiencing.
4:45 a.m. ward rounds?
No, not at all. Nobody starts working at that hour. Nobody does.
Yeah, it's a shock for most of the fellows.
Yeah, yeah. And even if you talk about the city per se, the cafes and most of the restaurants, they start shutting at like 3 p.m., 4 p.m., which is another cultural shock for me because, we back home in Mumbai, we used to going out late in the night, like, 11 p.m., 12 p.m. You will see us outside on the roads, streets, walking, doing whatever it is that you're doing. That's not possible in Brisbane here.
And now tell me, do you know how to boil an egg now?
Yes, I do. I didn't know how to cook first, but yeah, the moment I got to Brisbane, I started doing a few things in my free time. And now I'm good at basic cooking, like boiling eggs or making pasta, ready-made pasta, and, making toast and stuff. And I also learned how to put on the dishwasher.
Congratulations. Yeah, good. Now, I've seen you here in Australia doing, in the fellowship doing complex cases like arthroscopic rotator cuff repairs. Tell me an emotionally rewarding experience you've had in theatre and in surgery.
Well, I've had a couple of rewarding experiences. Specifically, I can mention a few. Like, there was this one incident where the cuff was like super retracted. There was a massive tear. And then, preparing everything, spending your entire time getting the cuff back and sitting it nicely, sit on the footprint without any tension, that's going to work.
Yeah.
And when you talk about arthroplasties, just when you cut the joint open, you see this severe arthritis. There's a B2, B3 glenoid, and then putting the reverse in, and you know that that's going to work. Yeah, those were like really good ones.
Yeah, it's super rewarding, isn't it?
It is. It is. It is.
All right, that's the operating in theatre. What about interacting with patients and consulting with patients? What have you learned from there?
So one thing I learned from you, Ken, was to be truthful. Whatever it is, just let the patient know what it is, and the patient understands. You understand, and you set realistic boundaries with the patient. The patient can't come thinking that he's going to be 100% what he was, or he's going to be a superman or something. You need to set realistic boundaries, taking into account what pathology the patient has. And that's one thing that I've learned from you. Just be straight, be nice, and be dedicated to your patients. Yeah.
Yeah, I think there's that saying, under promise and over deliver,
Yeah.
and I think that is a good concept there.
That's a good way of saying that.
Yeah.
Yeah.
I ask all the fellows, what is the most important skill when you're dealing with patients, with people?
Communication.
Oh, it's listening, actually.
Communication.
Listening is the single most important personal skill. Yeah. Now, what about family sacrifices? Your wife,
Yes.
lovely wife, not been together for long, and she's pregnant. She's gone back to Mumbai.
Yeah.
How's that been?
Yeah, she flew back 2 months back. We're expecting a child in October. So
Congratulations.
thank you so
You're
much.
pretty excited. This is your first one, isn't it?
First one.
Yeah.
So the first trimester sickness was bad for her. She was just vomiting and puking everywhere. I did my best, whatever I could. But then she's like, she needs to go back now. So she went back, and I'm going to be joining her in 2 weeks.
Yeah, pretty excited. Well, you're coming to the end of 12 months.
Yes.
Pretty exciting, isn't it?
Yeah. I'm excited to see her and everyone back home. Yeah. And can't wait to see my little child end in October.
Yeah, right. Now, I just want to come back to your career and how you got here. I think a lot of people won't understand quite what you have to do to get there.
Right.
You've won some awards. Can you tell us about the awards you've won?
Yeah, so I right through my residency and my med school, I've been having a knack for research and presentations and stuff. So I did win a couple of awards. Like one of the awards that I won when I was in med school was Indian Council of Medical Research Award grant. It's a small grant that they give, but it's kind of, it promotes you to start thinking in terms of research and, what is expected in a research environment. I did the small study on urinalysis when I was in med school, and I got a grant of like 10K. That's around, I guess, 150, 200 Australian dollars now. Yeah. And the other one was I got the best paper award in when I was doing MD pharmacology. I wrote a paper on the ethical aspects of paper publication. Like, I looked into terms like salami slicing and stuff, which happens on a regular basis all over the globe. So yeah, I got a grant of $300 Australian. So yeah, these two awards were good. I was also an international resident member for AAOS.
Yes, I saw that.
Yeah.
So what's involved in that? What do you have to do to achieve that?
Nothing. So AAOS just looks into you as a person and then just picks.
So can you explain what AAOS is?
So AAOS is the American Academy of Orthopedic Surgeons. It's the American equivalent of any orthopedic body. So every month, every year, it goes around looking into specific orthopedic surgeons, residents, fellows, etc. And they look into your achievements, and then they decide to award you, whatever, etc. So that was one thing.
And you were what, a resident with the AAOS?
Yes.
What's that?
No, I was a resident member.
Resident member. Okay.
Yeah, right.
All right. Good. And then publications. You've got a few publications now. These are in peer-reviewed scientific journals.
Right, correct. So I have around 25 publications.
It's crazy, isn't it?
And I still have a couple more coming with you, Ken.
We do.
So yeah,
We do.
I'm waiting for those. Those are going to be good.
Yeah.
Right. But I have a couple that I did in my previous residency and my previous fellowships. So yeah, like one paper kind of leads to another, and then you start thinking in a particular way, and then you get better at better in writing papers. It just works out.
And you're an author. You've published a handbook on arthroscopy.
Yes.
Tell me about that.
So I published a small guide for residents and fellows. This is with my professor and my unit head, Dr. Sachin Kale. I was in his unit in my residency. So he came up with the idea of going ahead and writing a book. And that's what we did. So this book is mainly targeted towards residents and fellows and everyone who's starting the journey of arthroscopy. It's a knee and shoulder dominated book where, like the intricacies of arthroscopy, like making portals or doing basic cuff repair or ACL surgeries and instabilities, etc. They're kind of described, or setting up arthroscopic equipment like light source and shaver blades, etc., which nobody actually talks about. So they're kind of explained in that. So yeah.
And we tend to take it for granted that what you just described there in Australia and say the US, but in India, because I've been an operator in India, taken for granted is not the case,
No.
because a lot of the hospitals are still learning this expertise, aren't they?
Right.
So it's very helpful for the Indian
Yes,
surgeons,
it is.
isn't it?
Yes, it is. Yes,
Yeah,
it is.
cool. What advice would you have to young surgeons in India wanting to come to Australia on a fellowship?
So one thing I would like to tell them is first decide as to what field you want to specialize in. So many of them just apply randomly to many random people without knowing what they want to do, and they just want to see where it hits and they go there. That's not how you should be doing. You should be dedicated towards one particular field and then try your best to get into that particular fellowship, because you know what that fellowship is going to offer you. And so, I mean, they have a wrong notion of, I don't know, maybe it's because of the competition that they try applying to multiple places and they want to see where it sticks. And, then that leads to another.
Yeah, look, I had that experience as the chief supervisor of the fellowships. I receive a couple of emails a day from surgeons around the world, and a lot of them are clearly they've just been sent to everywhere. They'll often talk about my knee fellowship, and if we're getting that number of applications a day, every day, for only a couple of spots,
Right.
and it's really disconcerting to see that come through.
Yeah.
Rather than someone thinking about it and emailing. I don't mind if they have got a couple of different career pathways, but I think they need to get that name of the fellowship right to start with,
Yes.
and actually say that or they'll have the title right, but then they'll talk about how they want to do knee surgery.
Right.
And they come through all the time.
Yeah, that's what I meant. Like, you should know what you want to do.
Yeah, have a
Right.
plan.
Yes, 100%.
Yeah. What does going back to India look for you now?
Yeah, so I'm job hunting now. When I go back, I'll be doing that on all full fronts. And yeah, I look to go back and work as a consultant in a corporate hospital. Let's see how that goes. Initially, I will have to do a couple of knees as well, but then over a year or two, I want to just limit myself to shoulders, and that's what I want to do: shoulder surgery, become a shoulder surgeon, shoulder expert.
Do it.
Yeah,
That sounds good to me. All right. Well, thank you, Rohit. Thank you for coming in and having a chat. I think it's been fantastic having you this year in the fellowship, and I wish you all the best.
Thank you so much for having me, Ken, and I've enjoyed every bit of this fellowship. And I wish you the best for your future fellows to, who would be coming in.
Thank you.
Yeah.
And I look forward to seeing some photos of your new baby.
Yes,
when
I will.
when they arrive.
Thank you so much, Ken. Thank you.
Wonderful. Thank you for listening. If you found value in this conversation, I encourage you to share it, leave a rating, or write a review. Your support helps others discover the podcast. To stay updated, make sure you subscribe on your podcast app or on YouTube over at my channel, Dr. Kenneth Cutbush, to ensure you don't miss an episode. New episodes are released every fortnight, each offering an in-depth look into the world of orthopedic shoulder surgery. Until next time, thank you for listening, and goodbye for now.